if you have hiatal hernia syndrome or you just have the acid reflux that's kind of chronic, you're likely on a PPI, a proton pump inhibitor. These drugs have a lot of different side effects, and today I want to talk to you about loss of libido or decreased libido, sex drive, as a result of being on these medications. So there's a few different ways that the PPIs do this. One is that it decreases, because you need stomach acid in order to absorb magnesium, calcium, vitamin B12 in particular for this conversation. When you don't have enough stomach acid, those two minerals and that vitamin B12 are not absorbed the way they should be. When you have decreased absorption, you can get a diminishment of testosterone because of that, as well as a decrease of dopamine. And dopamine has a lot to do with your desire, sexual desire, as well as your overall motivation. So those two areas are compromised. So for men and women alike, we produce testosterone as well, certainly not as much as men. But when that hormone is diminished and our dopamine is diminished, then sex drive can diminish as well. The other area that I want to talk about is just overall mental health, because PPIs are linked to anxiety and depression, and people who are anxious and depressed will have a lower libido. So the mechanism associated with the anxiety and depression stems from the fact that with decreased stomach acid, you're more likely to get infections, because your stomach acid is there to kill organisms that are normally in our diet. It's not that you're exerting poor food hygiene in any way, but there are organisms in our food, and the first destination that your food hits after your mouth has chewed it up a bit is the stomach, and it's supposed to be a bag of hydrochloric acid to kill off those bad organisms. But with diminished acid in your stomach, you're not doing that, so you're more likely to get that these bad organisms can propagate, they can happily multiply, and that can create imbalance in what's called your microbiome, which is anywhere from 60 to 100 trillion organisms in your gut that are very responsible for a lot of different things. When they're healthy, they do a lot for you as far as your immune strength, but also 90% of your serotonin, which is your mood stabilizer, giving you happy mood, it's produced in the gut. So when that microbiome is offset by too many bad guys and not enough good guys, you're not producing as much serotonin. Therefore, you're likely to be more depressed and anxious. Therefore, out goes the libido. So that's the cascade there. Another thing that PPIs do is that they can cause drug interactions. One is with thyroid medication, so it decreases your absorption. And your thyroid naturally has a lot to do with energy and mood and sex drive. So if you are needing thyroid medication and you're taking it, but you're not absorbing as much, your libido can get affected that way. Another key area that's quite concerning is that PPIs inhibit a certain liver enzyme. So this is CYP2C19, in case you were dying to know the name of that liver enzyme. But the key here is that it's inhibiting it. And your liver is responsible for breaking down toxins, and it's a very complex arena that involves how the liver breaks down certain toxins, and that includes drugs. So drugs pass through your liver and they have to be metabolized, they have to be broken down. So if you're inhibiting this particular liver enzyme's ability to do that, then drugs like Celexa, Lexapro, and Valium are not going to be broken down the way they should. So you then have an accumulation of that drug in your system because it's not being metabolized properly. So you can have symptoms like drowsiness, what's called emotional blunting. So certain times people on these psychiatric medications say, I just feel like a robot, like I don't feel anything anymore. So it's drowsiness, emotional blunting, and loss of libido. So those are because you're getting, I mean, these drugs do that anyway. You know, they have the emotional blunting and the drowsiness and the loss of libido. But now you're sort of, it's like you're overdosing. You're taking too much of it because your liver enzyme is not being able to break it down. So these side effects of loss of libido can take a little time to develop because it takes some time to develop the deficiency and the imbalance in the microbiome. That doesn't just happen overnight. So of course you start taking the PPI, and this is a good point to mention that the Food and Drug Administration only approves these for 2 weeks at a time. And so, but most people are on them for months, years, and decades, literally. So, you start a drug and it's new and you're sort of very aware of how you feel and what you're noticing. And of course it's for acid reflux, so you're mostly focusing on that and how is that feeling. And if that's feeling better, if diminishing your stomach acid is diminishing your reflux, then you're happy about that. So, 3, 4, 5 months later, you start suffering from loss of libido, you don't connect it because it's been several months already. So that's why I'm sharing this, because there are so many better ways to handle acid reflux other than being on a PPI. And the side effects are not just what I'm talking about right now, loss of libido, but they are heart disease, heart attack, stomach cancer, kidney disease, osteoporosis, the infections, as I mentioned a little bit earlier. So there's a wide range of side effects that some of which are life-threatening that you should really know about. So this is another one to add to the list, but if you are noticing this, then of course I want to get to the root cause of why you have acid reflux. What is forcing your stomach to push the acid up the esophagus, and just get to the root cause of that naturally, and not needing this drug. And that's something that we do specialize in. And I'm not saying we say, okay, just stop your drug. Of course we do not do that. We get to the root cause. We take the pressure off the stomach, whatever the source is that's creating the reflux. Sometimes it's not enough acid, but we figure that out, and then we can safely wean you off the drug. So I'm not saying just stop taking the drug, because then there's side effects associated with that aren't pleasant. But there are ways, they're natural and very effective, and of course that's what I want for you. I want you to feel great and really enjoy life. So if you enjoyed this content, please give it a thumbs up. Consider subscribing to the channel. We're trying to increase our subscribers so that more people can see this information and get exposed to it and know the options that they have to get well and improve their health naturally. So I'm excited to do that. I appreciate all of you. I appreciate your comments. I try to answer each and every one of them, and I'll see you soon.